All right, guys, I think we'll get started. Um, for those of you who have joined us, thank you so much for taking the time out of your day to come and have a chat about some considerations and strategies for offering telehealth support. For those of you who don't know me, my name is Zoe Milgram, and I'm an associate genetic counsellor and one of the co-founders of Eugene Labs. I'm here today together with Emma Harrison and Stephanie Grube, who are also genetic counsellors with Eugene, and we provide all the counselling and support to all of the clients at Eugene. A couple of housekeeping rules for webinars. First and foremost, this is the first time I'm hosting a webinar, so apologies if we have technical faults, but we'll try and keep to time and ensure that everyone has a really good experience. Please make sure your computers are all on mute. You should have joined in that capacity, but if you're not, please make sure that you are. Please also note that this session is being recorded and will be made available at the completion of the session. Today, I'd really like to make it as casual as physically possible, and we'll absolutely leave heaps of time to answer any of your questions at the end. You'll notice that there is a Q&A button on your screen. Please enter all of your questions there. Steph and Emma will keep an eye on these as I chat to you, and we'll absolutely make time to answer them, as many of them as we can, at the end. There's also a hands up option. So when we are at question time, if there's something that's been missed or you really want to share an idea, please pop your hand up and we'll open up your mic access for you. During the presentation, we won't be answering questions, so keep a tally of them, and certainly we'll try and get to them as many of them as possible. Any that we don't get to, we will potentially collate an FAQ sheet afterwards. That was just a thought right now, so hopefully the girls are on board with that. But before we launch into this webinar, it would be really great to get a snapshot of everyone who is here with us. So I'm going to share a short 5-question poll to just gauge the experience of the audience when it comes to telehealth. So we'll just give it about a minute for you to fill out this questionnaire, and then we can share it so everyone can see who is here with us today. So hopefully you can all see this now. I'll be quiet and let you read. If anyone's having trouble voting, you can click hopefully on that poll to enter. Here we go. Last couple of seconds. And I'm going to end the poll, and you'll be able to see all the shared responses. Alrighty, so just to summarize how the audience has responded to these questions in terms of providing video-based telehealth appointments before, the majority certainly have. This was something that was offered pre-COVID, again for the majority, which is really great to see that we're all taking to this awesome way of reaching more people as well. In terms of video-based telehealth as a service delivery model, it's really interesting to see that a lot of you find it worse than face-to-face appointments. So hopefully at the end of today, we'll be able to help share some of our tips and tricks that we've learnt from our experience, so that you hopefully start to feel that it can be as good as face-to-face appointments. In terms of practical perspectives, we totally agree with you that finding a suitable space to provide your telehealth is really hard. I've been really lucky that I've been able to convert this room into my house into a nice little cozy study nook for me, but we do recognise that that can be really, really challenging, and so we'll talk through some ideas around that before. In terms of telehealth platforms, obviously, we'll talk a little bit about that. I know for a lot of you, you are defined by what your healthcare service enables you, and VPN access and things like that, but we'll talk through some of the considerations that you can take. In terms of the psychosocial perspective, in terms of providing video consultations, we completely agree with you. Controlling a client's environment is really, really challenging. We've had some really interesting places that people have taken calls, and you know, it certainly is probably one of the biggest hurdles that we need to help teach our clients how they can best prepare. So without further ado, we'll stop sharing that poll and we'll move on. Just bear with me while I move things around my screen. Alrighty, so just give me 1 minute. I don't know if you can all see me now. Anyhow, we'll move on. So in terms of Eugene, we are really, really passionate about providing compassionate and convenient genetic counselling from the comfort of people's homes. For those of you who have used our service personally or professionally, or those who are yet to refer to Eugene, we hope that you can all agree that we are completely obsessed with being client-centered, and that all of the choices we make are all about ensuring that the client feels as in control of their journey with us as possible. Since we launched in October 2018, we've seen over 1,700 people and provided pre and post-test genetic counselling alongside an expanded carrier screening panel. And to say the least, we've learnt a lot from this journey. So today I wanted to share some of our learnings and hopefully help you feel a little bit more excited and empowered about offering telehealth services to your clients. Alrighty, so for many of us, the move from face-to-face appointments can be a bit of a daunting one, but there are really some simple and important considerations that you can use to help adjust to this service delivery model, although I'm aware that a lot of you are already also doing this. The 5 main areas that I'll cover today are: what tools do you need to provide healthcare online, some key considerations when offering telehealth, psychosocial differences between face-to-face and telehealth appointments, the importance of privacy and confidentiality, and also the importance of clinical documentation. So in terms of those people who work within a larger public or private healthcare service, a lot of these choices won't be your own, so you will be relying on tech support to upskill you at home. But there are some really important things that you can and should control to maximize you and your client's experience. So as you can probably see, I've got a little earbud in my ear that helps just offer a clearer sound for your video conferencing, rather than collecting any reverberations or noises that are happening at home. I know a lot of us are in ISO at the moment, and a lot of us have families. And so being able to find privacy is really, really important, but also to mitigate the feeling that potentially someone else is in the room, which obviously there is not. Obviously, needing a service to offer telehealth is really important. I'll talk a little bit more about that. Booking systems are really helpful. If you're not part of a larger healthcare network that has admin support and booking systems, you'll need to find one of these to help support you. And the best thing that we've been able to do is integrate our booking systems with our telehealth service provider as well. So it just makes it a really seamless service for us to manage, but also for our clients as well. Private rooms, as I mentioned already, super important. We really acknowledge that for many people, they're having to make calls from their bedroom, which means that not only your work and your private space are merged, which is hard and challenging on you as a human, but also that finding time during the day when your kids might be running around is also challenging. So we'll talk a little bit about flexible consult hours. That's a really big part of our service at Eugene. Also good light. I hope I don't blind you, but what I'm going to show you is a little piece of lighting that I invested in. As you can see, my room's really dark, but this little circle helps light me up. So whether I'm taking calls at night or early in the morning, I always look the same for the most part. So that's a really helpful thing to think about. In terms of our setup, I don't want to spend too much time because everyone will have their own limitations and expectations. But some of the things that are really important for us are making the user experience really good. So making people always feel like they're in the driver's seat. So our online booking system is accessible via web or mobile. People can jump online, read some basic information. I hope a lot of you have been on our website and agree that it's friendly and clear and simple to use. Something that booking systems have enabled us to do is to automate reminders. So life is generally pretty busy, but remembering those important appointments, especially when you're not having to drive to them and park, but just log in online, is the automated reminders. And for us, we provide a booking confirmation at the time of booking, a reminder the day of the appointment, and then a quick heads up SMS 10 minutes before the appointment to say, get ready, your genetic counsellor will be online waiting for you, looking forward to seeing you soon. And what that's really been able to do for us is lower our FTAs. So we have a really high attendance rate, and people really feel in control of that. And if they're unable to attend, we make it really easy for them to shoot us back a message or an email saying we can't attend, and they're able to rebook with no cost to the client either. Obviously, secure video conferencing applications are incredibly important. Really quickly, end-to-end encryption of video meetings is incredibly important. At Eugene, we're very conscious about health information and privacy of that. So we're compliant across the HIPAA requirements. Something else that we do a little bit above and beyond is we create unique video conference rooms for each patient, meaning there can be no drop-ins. You know exactly who's going to be on the call, and so do they. In terms of healthcare providers and patient calendar integrations, these are really helpful for us. As you know, you'll be having a lot of extra meetings, lots of dial-in conferences and things like that. So having a calendar that can adapt to the other meetings that may pop up in your life is really helpful, so you don't end up double booking. Something that we've also done is built an intake questionnaire, and what that does is it collects the basic health information about the genetic, medical and family history, a lot of things that are really important to genetic counsellors and geneticists' appointments. And what that's really been able to empower us to do is to spend the time focusing on the clients who are sitting in front of us. Alrighty, let's jump into some more technical stuff. So in terms of video conferencing applications, as I mentioned, super important that they're encrypted and HIPAA compliant. Again, the unique conferencing rooms is an added bonus for keeping track of whom you are seeing and when. It also means that with these unique rooms that individuals can join from different locations. So prior to COVID, a lot of our clients were taking calls during lunchtime or at other times during their day, not having to leave their workplaces. And it meant that the 3 or 4 or however many people were joining the consultation could be there together. This has been really powerful in donor arrangements where we might have a donor dialing in from a different state to the recipient, which is again a different state from us. So super, super powerful thing to think about. In terms of the application that you use for your conferencing, it's really important that it can work across a number of different devices, whether they're iOS or Android, phones, Mac, just making sure that as many people as possible can join that as easily as possible. We also acknowledge that for people when they're taking calls at work, video isn't always helpful. So having the capacity to just make that audio is incredibly important sometimes. In terms of options to customize the patient and healthcare professional experience, there are some things that you can do depending on the sort of service that you want to provide. But for us, our genetic counselors are always on the call before the client joins. I had an experience being a patient this week on telehealth and sitting there looking at myself in the camera, waiting for the physician to join. And that was actually really almost more anxiety provoking than sitting in a waiting room. So just something to keep in mind in terms of that. It also changes the power dynamic a little bit in putting the client in the driver's seat, which is quite a unique thing that waiting rooms don't really have the capacity to offer. In terms of sharing screens, just like I'm doing with you today, in all our pre and post-test appointments, we have the capacity to use whiteboard features if we're wanting to draw any diagrams. And during results appointments, we always share the reports with the client after asking if they're comfortable with that. We find that having a visible document minimizes the chance that people get stuck on trying to remember the words that you're saying and the complex disease names. It also means they don't have to write notes, which is really nice. In terms of booking systems, really, really important to consider in terms of not double booking yourself, making sure that there's consistency of care. So for us, all our clients see the same genetic counsellor throughout their journey. And so while the genetic counsellor that they meet for the first time is random, that genetic counsellor will always follow through to completion and then be able to provide any follow-up support that's required depending on the outcome. We have our calendars completely visible to our clients, which means that they can see what availabilities we have and then choose something that suits them rather than them trying to have to coordinate or move their days around to fit in with just the one availability. In terms of integrations, super, super important. We are so grateful to have our amazing tech team who are able to build a lot of these systems in for us and make it a really seamless experience, which we feel really, really lucky about. But there are some really basic tools that you can use to help improve that for yourselves as well. In terms of intake questionnaires, we do have this information in advance of our appointments, which makes building rapport with couples really easy. People are actually incredibly open about sharing difficult experiences in their past, which we found has been really, really helpful for being able to show empathy towards the patients and understand where they're coming from, what their expectations are, and to provide the best clinical support that we absolutely can. Privacy and confidentiality, we are absolutely obsessed with this. We're building all our own internal and external facing tech. So for us, following HIPAA and GDPR considerations is incredibly important. We do offer genetic counselling outside of Australia, and so we're very, very mindful of where those clients are and making sure that their health data is stored in a way that is appropriate for them in terms of their healthcare systems as well. In terms of offering telehealth, security and privacy is really, really important. Obviously, everyone's moving across to this at the moment, but making sure that your services are compliant across the regulations is really important. I've mentioned a million times about location used to take calls need to be private, and something that a lot of supervisors or senior genetic counsellors or medical practitioners are aware of is that there is actually a real challenge to being away from our peers. Debriefing can be more challenging, but something that a lot of people might start thinking about is whether they feel comfortable recording sessions. Obviously, it's very, very important to obtain consent from the clients prior to this, and then to be storing that data in a secure way. In terms of terms and conditions, transparency is super important. A lot of people have an issue of trust when it comes to this new service delivery. You know, who's got my data, where's it's being stored. And so for us and for anyone who is providing online services, you really need to make sure that you have your terms and conditions really clear. All right, clinical documentation. I know that for many of you, you will have piles of paper files around the place, and that can be really stressful from confidentiality point of view, not to mention they're really heavy. So for us, clinical documentation was one of the first things that we digitized. It's really, really important for these documents to be stored in a secure way. But it also means that they're accessible. If someone calls and they've got a concern, there can be basic notes of where that client is on their journey so that they don't feel like they're being missed or lost. It also improves in building rapport. So when we're on a call with a client, we actually have their family history up on the screen at the same time. We're able to make notes or modifications to those family histories that they've provided. And it also means that we're really, really efficient with our time. So there's no transcribing things from paper written notes into a PMS system. In terms of some of the things that we've developed to try and improve efficiency, also to make sure we're not missing anything, because one of the things for us is that we see a lot of cases with a lot of similarities. And in order for us to remember who we've spoken to and what their story is, having checkbox systems that enable us to tick off the important must be said things is really helpful, and enables us to focus on the people in front of us and to really make sure that we hear and listen and respond to their concerns as well. Something that I forgot to mention is that Emma and Steph are on in the background, and if I forget anything really important, they may jump in and offer some pearls of wisdom as well. So don't be surprised if you hear other voices. In terms of monitoring and documenting where people are, one of the main concerns for the audience was that they can't control where people are when they take these calls. Something that we do, which we found really helpful, is we provide a really short email of what to expect from the appointment and what sorts of things will be discussed. We suggest that a private space is a really important thing when having genetic counselling. And one of the things that we're really, really conscious of is we know if we're going to be delivering a high risk result, and we actually sort of steer those couples into certain time slots. They tend to be after hours, where the couple are more likely to be at home, where they'll have space to absorb that information, and also it means that we've blocked out enough time to be there to support them as well. Some of the benefits about telehealth are, and it's, you know, I'm not hiding it, we absolutely love everything that telehealth does for us. Not only does it provide timely access to appointments for our client, but it really improves that access. So one of our favorite clients, or client stories, is that Emma spoke to a man who was a rural farmer north of Mildura, and he was, you know, he was there on his video chat, having a chat with Emma, you know, talking about the struggles that he and his wife had had with their fertility. And there they were able, you know, to access an expert in their own space without having to drive those 5 hours or potentially wait months and months for an appointment or an outreach clinic. So I'm sure a lot of outreach clinics are loving, from a genetic counsellor point of view, the capacity to offer those services without interrupting your lives as well. It really, really promotes and enables flexibility for the provider and the client. We have the majority of our patients are seen before or after hours. This really helps us as well. I know it definitely has helped me a lot since we've been in lockdown. got my kids to look after, but I've still got clients to see. So having that flexibility is not only great for me, but it's also really great for the client. And it's something that they love the most about our service. Obviously, there's a reduced travel time. It is really, really important to reduce face-to-face contact, particularly at this time. But something that we've really noticed is that it promotes a shared agenda. A lot of that bricks and mortar communication can happen over email or through video content that's shared with clients. And it really helps us just focus on what the client needs from us at that time. And that's a really, really powerful thing to be able to offer people. So really being able to focus on their needs and concerns rather than our agenda. And I know we're always, trying to be client focused, but sometimes there are things that must be done. And by being able to remove these from the consult really gives you time to focus on that. We've really found an openness in communication when people speaking to people over the web. Most of our clients are at home on the couch. They might have a mug of tea. Some people have had a really bad day, or they're really nervous. They've got a glass of wine. That's really, really helpful. Everyone. We really want to balance out that power dynamic. Yes, we're genetic counselors, and yes, other healthcare providers do have a perceived authority from the client, but by being more like a friend who is also an expert, there's this beautiful relationship that can develop very, very quickly. In terms of patient anxiety and vulnerability, being online, not making them wait is really, really powerful, but also enabling them to end calls when it gets too much and to touch base when they feel ready to continue those conversations is a really powerful tool. Obviously, there are limitations to telehealth. I'm not going to lie here. Clients' perceptions of the appointments are altered. They don't take them as seriously. They certainly think that they have a lot more control about what's said and in what context. And so really making sure that you feel empowered because you know what needs to be communicated, and to do that in a really friendly way. Obviously, controlling the client's environment is impossible. I've ended appointments where people, were with their manicurist, or, just doing ridiculous things because they weren't taking the appointment seriously. So, having the guts to say, look, there's some things about this appointment that I feel would be best discussed in private. Why don't I send you a link and you can book in for a time where you're at home or in a quieter place? I think is really important. We want to be there and we want to help them when they think it's right, but we also have a lot of experience, and I think we need to draw on that to give people the best outcomes as possible. Obviously, internet connectivity, massive problem. I drop out. I make sure I always make a great face like that so that people get to have a laugh. But certainly, everything will come back. And if it doesn't, you've always got your fallback. You can always call them and let them know that the service has gone down. Things don't always have to be perfect. Obviously, if you're providing telehealth at home, you do need access to a video and audio enabled computer. A lot of you may only have desktops at work, so I'm sure there's been a huge hustle to get you all mobile and at home. In terms of the conferencing services, for us, we do require clients to download an app, much like all of you would have had to do today. But as you are probably becoming more aware, more people have these applications on their phone, and they're actually really easy. And then they enjoy using them and sharing them with their family and friends as well to stay connected. Obviously, demographics is a really challenging thing for us. Our demographic are currently people who are in the reproductive stages of life, so they tend to be pretty tech savvy, have smartphones and things like that. But obviously, in other capacities, that would be more difficult. And so obviously, telehealth is always a really, really good backup. In terms of clients whose English is a second language or require interpreters, something that we're seriously considering is much like you would have in a hospital service, seeing if we can get a series of interpreters who would be able to join a call and be a third party to that conversation to provide real-time translation as well. Cultural barriers are obviously an issue. I know there are a lot of religious groups where being in a room with a woman as a man is a challenge. Obviously, this overcomes that. But as healthcare professionals, just being really mindful of who people are and what their beliefs are, and incorporating that into your appointments. Some super helpful resources, which I'm sure you've all been privy to, particularly for those with provider numbers. You know that there's an MBS number so that you can bulk bill for appointments due to COVID. This is obviously a real change. I know a lot of healthcare providers have been lobbying for a long time to get telehealth covered. So this is a really good time to be picking up your telehealth services. Also, at Eugene, we're really mindful that we're developing a new way of engaging in genetic health and counselling. So we're always happy to share, and it's exactly why we've done this webinar today. So some learnings, just to summarise, is just to be mindful that video conferencing does change the dynamic. It does promote patient autonomy in the session, and that we should always be compassionate about where people are at. Particularly, there's a lot of extra pressure and stress that people are experiencing around, losing their jobs, worrying about loved ones. And our consult times have actually gotten much longer in the last couple of weeks, as people might not speak to anyone other than you that day. And so really making space to support them along that as well, while creating boundaries in terms of your clinical capacity is super important. We find that without video, we lose so much. So video is incredibly important for capturing those body cues. If someone's feeling worried, you'll see it. If their partner's wanting to protect them, you'll see them put their arm around them. And there's a real sense of security in being able to see each other and see, not only for them to see you and how you're reacting and your facial expressions. I know I would be a terrible poker player because you can see exactly what I think, but I think, in yourself, being really, really human about what you're saying, it enables you to connect even when you're not in the same room. Convenient appointment times, absolutely critical. For us, this is a game changer. I know for a lot of services, this isn't possible. But if it is in your own capacity, really strongly, I couldn't recommend it anymore. I mean, I keep banging on about it. Something that we've learned is counselling skills are not compromised over telehealth. There's a whole lot of research out there about it. There's pros and cons, but being mindful of this and adapting the way you speak to people, modifying your tone, your pacing, it can all be done over health. Obviously, we can't reach out and hold their hand, but showing empathy to someone is very real and raw. And I feel weird not knowing how many of you are out there and whether you're watching or whether you're just listening. And so just getting comfortable in your own skin, talking to a computer screen can be a challenge as well. Consistency of care is super important. I know in a lot of larger clinics, you'll be rostered on odd days and you may not get to follow through with clients. Telehealth can enable you to potentially improve that consistency if it feels important for a specific client. Having appropriate plans in place if you're suddenly unavailable. I know that stuff happens. Lots of us have kids at home, drama might happen, something might need to get moved. We've got a buddy system here at Eugene, so if we are unavailable, we know that we can pass that client on to a colleague at the last minute, and if not, we absolutely are in touch with them to let them know that we're really sorry we can't attend. Timely correspondence is super helpful when you're online. We're able to release reports immediately following those post-test consultations, meaning that clients feel empowered. The pressure for them to take notes and remember things is minimized. It also means that we can keep the referring doctors in the loop straight away, because as we all know, if we have to deliver bad news, the next person that they pick up a phone to is often their obstetrician, saying, oh my goodness, I've got this result, I don't know what to do. And so for us, ensuring that the referring or tertiary doctor is aware to and expect that call is really, really important for consistency of care, not only from a healthcare provider perspective, but from the client, knowing that even though they are on this digital format, they may be with a private group, that consistency is facilitated and supported, and shared care is really easy. Because you're all here and because Eugene is really, really important to us, I wanted to share what it feels like, or what it will feel like very soon, to be a client at Eugene. So we use saliva-based collection DNA kits, which are sent directly to clients' homes. We're working on an app which will help clone our clinical team so that we can see more people at more times in a time that suits that client, having information that can be reviewed again and again to help improve understanding and potentially be shared with doctors or family members is super important. A little bit about our team. So we are larger than this now. We are growing, which is really lovely, particularly in this climate, to see that convenient online healthcare is really, really important. So I really want to shout out to my team for making today possible, for helping me work out this webinar and build these slides for you. We are always all online and available if you've got questions, so please don't hesitate to reach out to any of us at any time. In saying that, if you want to refer any clients for expanded carrier screening and some awesome online genetic counselling, it's really, really easy. You can sign up online, or you can just send your referrals through to counsellors@eugenelabs.com. So thank you so much, everybody. I think we've still got 20 minutes for questions. So what I'm going to do is I'm going to stop the share, and hopefully you'll be able to see me. And I think, Emma, if you want to unmute yourself, we can have a look at some of the questions that have come in.
Hi, everyone. Thanks for joining us. So Zoe, one of the questions that's popped up is, how do you capture family history online? Do you write it in your clinical notes or have recommended pedigree software?
Beautiful. So we have actually built a family history questionnaire which gathers basic pedigree information and family medical histories. Our design and tech team have actually been able to build a model that looks much like a pedigree, which we are able to view at the time of the appointment. We do also, when things get complex, particularly in cases of consanguinity, or there's a known family history of a specific condition, we do also physically draw out pedigrees, which are uploaded into the patient file and then destroyed. So I think the move for Emma, Steph and I from a really hand-based pedigree drawing platform to something more digital has been challenging, but the beautiful thing is we get to work with our team and they're able to build these technologies to suit our clinical practice. So a bit of both.
And I should say that in the building of those technologies is that our tech team very closely follow us and what we're doing. So they don't just say, here's a product, how does it feel? They very much mimic what we do, and we show them the ins and outs of everything that we do to enable them to build these things to match the requirements that we have. So just another question, you mentioned you have plans for interpreters who will be able to join video appointments. How are we managing ESL cases in the meantime?
Yeah, so at the moment we haven't had any cases where at least one partner doesn't speak English fluently. We are a small provider, but this is something, actually Emma had a client this morning and they just felt much more comfortable speaking in Arabic, and so we're launching into investigating those services. I know there are a lot of telehealth based services out there, and so that's something that we'll be bringing online very, very quickly.
I might give a few more minutes to see if anyone else has a few questions.
If anyone doesn't want to type a question, they want to ask one, you can just press the hands up button and we can unmute you and you can talk freely as well. I'm going to take the silence as you feel completely satisfied. Oh,
We have another question.
yeah.
Do you have many clients who don't have access to the right technology?
So the majority of our clients do have either a video-enabled computer or smartphone. For those who don't, we do offer telephone appointments. One of our clients lived really, really rurally and only had a landline, but absolutely, you know, we are here to provide support no matter what their technology is. Obviously, our preferred way to provide support is over video-enabled services, but you know, absolutely, if someone doesn't have the technology, doesn't mean they can't access support. Alrighty, so I think that is the end of the questions. Emma or Steph, is there anything that you wanted to add before we let everyone get on to their day?
There's one more question that's just come through, Zoe.
Yeah.
What video conferencing app do we currently use?
Yeah, so at the moment we use Zoom. We have pro accounts, which means that we are able to offer those unique conference rooms for each appointment. There are a number of other services out there. A lot of you will be locked into certain telehealth or video health models based on the hospital that you work in. But for us, we've found Zoom incredibly helpful and easy to use.
And I think this is another question, and we might leave it after this one, is do you have a process for patients who repeatedly do not take the consults in an appropriate space?
So, you know, I think we're really reasonable. For us, a lot of people take calls in their offices. We make sure they have a private room. If they feel like their conversation is going to be interrupted, or they're feeling unsafe, or like their privacy is being compromised, we always say, look, guys, just hang up. We understand that there are limitations to what you can do right now. If we don't finish the conversation, we'll shoot you an email and you can book in for another time. But really, you know, we don't want to make this experience any more awkward than it needs to be. So people get it pretty quickly that they need to be in private to have these sorts of calls.
Another thing I just want to quickly add to that is it's not impossible for people to join us whilst they might be in their car driving, in which case we've got a rule in the team that no one should be driving whilst they are doing a genetic counselling consult. So politely just asking them to either pull over or reschedule the appointment to make sure not only that they have their complete attention on the call, but also obviously to make sure that they're safe in their environment. So a few more questions are just coming through now. The first, do your patients pay in advance or after their appointment?
Yep. So the way we work is clients buy genetic carrier screening, which comes with their pre-test appointment included. If after that pre-test appointment they elect not to proceed with testing, we do provide them with a full refund. So we do ask for a bit of a commitment, but we have absolutely no qualms about refunding that if the clients feel that it is not appropriate for them after that appointment.
Another question is, how are you finding appointments at the moment with children at home?
I currently do almost all my consults after hours. Fortunately, my husband is also working from home, so we tag team. My boys know that if my door is closed, they are not allowed in. But I know Emma has a dog, and all our clients love bringing their dogs to their appointments as well. So that is definitely a lovely thing. But yeah, my kids are not allowed here, and I do a lot of after hours work.
And also to add to that, the whole clinical team is very obviously understanding of each of our circumstances. And as Zoe mentioned earlier with the buddy system, part of it is making sure that we're all comfortable in the current climate, and making sure that, if we know that Zoe's got 2 children, Steph and I are yet to have our families. And so being able to say to Zoe, we'll take the day appointments. Do you mind if we give you a few, of the after hour ones, or vice versa? That's been really helpful. And obviously we're understanding that a lot of you guys might not have such flexibility amongst your team, but trying to work out a roster of when people are doing their consults can be really, really helpful as well. A few more questions coming in. So are patients generally satisfied with the telehealth experience in comparison to regular consults?
Yeah, so something that we do in the startup and tech world is, I mean, everyone loves to know how people enjoy their service. So we do send out a questionnaire 1 month after clients have finished their journey with us, asking them about their experience. And all of those sort of measurements are put into something called a Net Promoter Score, or an NPS. And an NPS is a number where anything below 7 is actually considered bad, and above that, it's an indication that that client would recommend our service or product to a friend or family. So our NPS score is currently above 90, and not that this is a reflection of any of your services, but the current healthcare average is 7. So telehealth is loved. Having that privacy of being able to access healthcare specialists online is really, really attractive. And I think our after hours availability is a big factor in that score.
Yeah, and one thing I think that's important to add that I don't think we've said yet as well is that we are definitely not a group of people that are opposed to face-to-face consults. We've had something that comes to my mind straight away is a couple who were getting on a plane to go overseas and had found out they were pregnant the day before and had an emergency appointment with an obstetrician who kind of said, these are the things that we think you should consider. And they rang us, and we were, I mean, this was still at a time where we were in the office, and we were lucky enough to to say to them, come on in now, and one of us will be able to do your counselling appointment and collect samples at the same time. So, in terms of the satisfaction, I think it's much more about how you communicate with your patients and what you're able to offer them that also factors into, again, to their satisfaction. The next question is about where this recording can be accessed. So after the conclusion of the webinar, we will send the recording through to all of you, and we'll also possibly have it open elsewhere. So we'll email you guys and let you know where you can access the recording. Do you have any tips for improving the counselling experience where clients are using audio only?
Yeah, so obviously, little mic, super helpful for cutting out background noise. In terms of losing those visual cues, for us, they're so important for genetic counsellors, or really any healthcare provider. You get so much from that unspoken word. So, when you don't have those visual cues, really honouring the silence is really, really important. I know it can feel awkward. You don't know if they're there anymore, but giving space, you can often hear people's breathing or if they're crying. So the quieter you are, the more you can actually glean. If you can hear a kid screaming in the background, perhaps they've dropped the phone to go and deal with that. So you do have to be more patient. It is certainly harder, but certainly, honouring that silence is really, really helpful and important.
One more thing that I'll add to that as well is I find a lot of power in asking the patient to repeat to me what I've said to ensure they're understanding what's going on. Or when I start a consult, I'll just say, hey, what's your understanding of what we're doing, so I can fill in the gaps accordingly and not overwhelm you with all the information. So constantly checking in, I think, particularly when patients can't see you, and I do this in both situations, but particularly when they can't see you, I think is also a really important thing to be doing, just to ensure that they're on the same page and that they have a complete understanding. And if they don't, working out a way together that can help them understand things. Once I was speaking to a couple, he was a builder and she was the admin assistant for his building company, and they just weren't understanding what I was saying. And so I just jumped into an analogy of a house that had a house that was being built with 2 walls in it at the moment, and one wall had a crack and the other didn't, versus both walls having a crack and the impact that might have if that house were to be a child with a genetic condition. So it's always just making sure that you check in with them and engage their understanding as well. The next question, and there's 2 more questions, and I think we're going to, just in the sake of time, we're going to probably cut it after that. So the first is a really good one about any tips for a patient that might be hearing impaired or that struggles to hear over the phone, but also does not have access to video capabilities?
Yeah, so with Zoom, you can also type. So there's a little chat function here. So we have used the chat function before. We do also acknowledge that, I don't know, sign language. Sign language is a really, really important way to be an inclusive service. So, you know, much like any interpreter for a different language, something that we would obviously consider having at our access would be an Auslan interpreter. But chat has been really, really helpful. I had a patient who had real challenges with auditory processing, not from a hearing point of view, but just from a brain damage experience she'd had, and being able to type out some of those important concepts for her were really, really powerful to her, also that she could reflect back on that and remember the consultation. So lots of different reasons why text is helpful as well.
I think another thing we'll have in our favour is the app that we're building, and the ability for them to provide written content based on the consult, so that they'll be able to have writing and subtitles as well, which will help people in that situation. And the last question for the day: how much do you think resistance to telehealth comes from genetic counsellors themselves, i.e. they are more comfortable with face-to-face?
Ooh, so I know that for our team, we had training around providing telehealth or video-based telehealth. You know, really being comfortable and I guess getting comfortable with being a little bit more vulnerable in your own self and your own space. It's definitely a skill that we are always honing, and I think, you know, the way we are trained is very much about that physical contact, but also acknowledging that these new technologies can bring our skills to so many people and empower them as well as the people that we can see face to face. I think has given, you know, us a lot of confidence in what we do, but, you know, certainly breaking molds and long standing ways of doing things is tricky. So embrace it. We are here to help. If anyone wants to call, you're always welcome to call us or email us.
Right, I think that's all of the questions at 1:07 p.m.
Alrighty, so thank you everyone for joining myself and the Eugene team today. We would love to hear from you, any tips or tricks that you've learned along the way. Any questions you have, please don't hesitate to use that counsellors@eugenelabs.com. I'll pop that up just one more time as you're all logging out so that you can see it. I think I've just killed that.
Whilst I was getting that up, we're also hoping to do a series of these webinars with some interesting topics based on our experience. So keep a lookout for some more emails coming your way over the next few weeks and months. Also to just keep the engagement alive in a scary time.
Thank you everyone for joining us. Have a beautiful afternoon.